Hello, my name is Micah Pengitore. I'm a physical therapist assistant here at Prairie Rehab in Sioux Falls, South Dakota. This is a tutorial we will be going over self-MLD for bilateral lower extremities. This tutorial is to help increase your technique for your home program that has already been developed by your physical therapy lymphedema specialist. Before we begin the demonstration, we will be reviewing the lymphatic drainage pathways, the hand placement, hand pressure, stroke pace, and lymphatic node sites. Draining pathways first. Draining pathways all lead to the heart, and then they are then urinated at the end. Second, hand placement and direction of the stroke. When I demonstrate this for you here, I'm going to demonstrate on my hand, but the hand placement and the direction of the stroke and the amount of pressure that is applied on here is the same when you do it on any part of your body. Lower extremities is what we're working on in this tutorial. So, when doing this is to, when doing MLD, it is to be used on all skin base, so to be on the skin, and you can use a little bit of lotion for some tackiness, so you can increase your stick or the skin movement that you need for this technique. Now, for the amount of pressure that you use. The amount of pressure you use should be light. If you push too hard, as you can see, redness occurs, and that red shows that you're pushing too hard. It should be a light pressure when you do this. Second, let's talk about how much hand, or the proper hand placement. You should only use your fingers, not the palm or your thumb. Those are not involved. It should be the fingers that envelop the area. Next, let's talk about the purpose and of the direction that you're moving the fluid. So you're going to do a perpendicular stretch and a purposeful motion going upwards towards the heart. Next, we talk about pacing. So we want a 1, 2, 3 pace. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. And that's the pacing you go when you're doing your strokes. Next, we talked about the node sites. We have cervical nodes, armpit nodes, and the groin nodes. All right, guys. Let's begin our demonstration here. And we will first start off with diaphragmatic breathing. First, we'll breathe in 3 breaths. Next, we'll do our stimulation of our node sites. Cross our hands. We'll take this off here. We will put our hands right above the clavicle into that dip that we have right here, that space. We'll do 10 pumps here, but mild, moderate pressure into that little dip there to stimulate the cervical nodes. So 10 there, hand placement on the neck, 10 strokes here, 1, 2, 3, 1, 2, 3, 10 here, 1, 2, 3, 1, 2, 3, 1, 2, 3. All right, now that we've stimulated these guys, we'll stimulate the armpit nodes. 1, 2, 3, 1, 2, 3. 10 here, 10 here as well. Since when going over this tutorial, since we are going over bilateral lower extremity edema, we do not stimulate the involved nodes, which would be the growing nodes for these ones. So we will begin as in we have to make a pathway for the lymphedema that is in the legs to go to, which our draining sites are going to be the armpits. So going up to the armpit nodes. And 7 strokes, 5 to 7 strokes, went up to the armpits. And still the same, 1, 2, 3, 1, 2, 3, 1, 2, 3. 7 this way, 7 this way. 1, 2, 3. That pacing, very important. So 7, 5 to 7 going this way. Full strokes 2. I will demonstrate on the right lower extremity first, and then I will go to the left lower extremity for the clearing of both lower extremities. First, we're going to go, you can do a single-handed, doing 5 to 7 strokes per side, keeping that good pace and good contact. Or you can do bilateral if you have the ability and the dexterity to do that. Then we do all surface areas. Or we can do single arm too as well, single hand as well. 5 to 7 here. 5 to 7 here. Now we don't want to forget to do the medial portion over here as well, the knee. Important area as well. 5 to 7 strokes here. You're starting proximal, going down to distal as you can see. And coming up through here, you can do double hands or single hands if you prefer. Just making sure you're doing all sides of the leg here. 5 to 7 strokes. Don't forget the calf. 5 to 7 strokes. All positions. I'm going to take my shoe off here because we want to make sure that we do the foot too as well. When doing this, we will do circular strokes on each toe. To get those going. It's still the same pace of 1, 2, 3. 1, 2, 3. Then you do the whole hand to envelop the top of the foot. We do not do the bottom of the foot when doing this. And then don't forget the ankle. You can do doubles like I'm doing here. You can do 1. And this side too as well. Now that we've done the whole entire leg, stimulate it all the way up, open up the clear pathways, now we go all the way up. I place my foot on here, for that is my most comfortable position. You do this for whatever is most comfortable for you. You could do single hand if you feel comfortable with that, all the way up, or you can do double hands, whatever is most comfortable for you. Alright, so we've done this lower extremity. Now I'll demonstrate for the other side. I'm going to take my shoe off already, slide my chair over. Same thing, still starting proximal. Or single hand if you want to. Doing doubles. Or singles. Good. Remember keeping that pace. 1, 2, 3. 1, 2, 3. 1, 2, 3. Got the medial portion there. Working our way up again. Sides, doubles or singles, whatever you like or can. Feel confident. Don't forget the calf. Don't forget the toes again on this here. On each toe with circles. Yeah, better view. Circles going upward. And then doing top of the foot just like the other side as well. Remember, all of these are 5 to 7 strokes. And then doing the ankle. 5 to 7 strokes. Now that I've done the whole entire foot, now we go all the way up just like we did this side. So coming through here, going through, don't forget the calf, going up the leg, going up the side. As you can see, I did doubles, but you could do singles if you want to. You do 5 to 7 strokes through the whole entire lower extremity. And that would be the whole lower extremity on that side. Now that we've gotten both lower extremities started, we want to make sure that we have a clearing path for each of the lymphatic fluid to go. Doing 5 to 7 strokes all the way up. But the big thing for the bilateral lower extremity, I want us to spend a little more time now that we've gotten all that fluid to go on a little bit of diaphragmatic breathing. So we did 3 in the beginning, but I want to do 10 with this one. So breathing in. Doing 10 for the final ones for the bilateral lower extremities. Okay? But also we don't want to forget about re-stimulating our nodes again. 10 strokes here. 10 strokes here. 10 pumps here. 10 strokes here. Keep that pace. 1, 2, 3. 1, 2, 3. All the time. Alright guys. For any questions, please contact our lymphedema specialist at 605-334-5630 or visit our website at prairiarehab.com. Thank you for watching.